name is Sam Wiebe, and I'm going to talk about the aspects of the new International League Against Epilepsy classification of seizures and epilepsies, especially related to global outreach and to diagnosis. So when we talk about global outreach, we really mean adoption of this classification by official agencies and international organizations. And when we talk about diagnosis, we refer to use by clinicians in clinical practice, in clinical communication, in teaching, and in research. Now, global outreach involves, for example, adoption by organizations like the International Codes for Diseases of the World Health Organization. And this is already being undertaken by a task force of the International League, which is incorporating the new classification terms in the proposed classification. It is work in progress, but it is being done. Another aspect is, for example, a task force from the Epidemiology Commission, which has put together a standards for epidemiological studies and surveillance of epilepsy, which includes the new classification and terminology that is being proposed. So this is key if we're going to manage to have a global outreach that is impactful and has enough of a dissemination that is useful for the new classification. Now, the key issue with any new system, terminology, or knowledge for that matter, for adoption by clinicians in diagnostic and in management is the added value of that system. And the added value has three elements to it: the cost, the risk, and the benefit. Now, in terms of risk, this is the main concern voiced by many of the epilepsy experts around the world. And the question is, should we undo what is already in place and took so many years to get working? Is it appropriate? Is it representative of all we need to know and apply in our practice? Is it comprehensive enough? Does it have all we need? Is it unambiguous? Is it clear enough, or does it lend itself to confusion? Can we apply it to all the circumstances we need to apply it, both in clinical research, for communication, and also, for example, for research? And is it user-friendly enough? With regards to costs, perhaps it's not so much financial cost, but it certainly is opportunity cost. The time, the effort that it takes to create the classification, to disseminate it, to educate people, and even to change thinking of people at various tiers: clinicians, students, researchers, health administrators, etc. All of that has to be considered when we look at the potential benefits that will be achieved with this classifications, which is purportedly a more evidence-based classification, one that takes into account new knowledge, research, one that reflects the best knowledge in terms of genetics, pathophysiology that was not available in the previous classification, and then improved clinical care, which is probably the bottom line for any new system or terminology that we try to implement. Finally, does it move the field forward? And this is potentially an area of strength of this new terminology, and is it fluid and adaptive? So what works when we think about areas of change in medical practice and in clinical terminology? From knowledge translation research, we know, for example, that there are some aspects that work minimally or not at all. And that includes, for example, passive dissemination, publication, distribution of written materials or printed materials has very little impact on clinician behavior and practice. On the other hand, strategies that sometimes work include audit and feedback, and the use of local opinion leaders to explain, instruct, and disseminate knowledge. Finally, strategies that appear to work more effectively and could be applied to the dissemination in diagnosis of the new classification include assessment of barriers, educational outreach, and reminders to clinicians, for example. And then especially effective are multifaceted interventions with combination strategies of teaching, audit, feedback, opinion leaders, etc. And remembering always that one size does not fit all. It has to be adapted to the specific context, to the culture, the population, and the purpose of the practice transformation teaching. Thank you.